Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Perindopril. Its brand name is Coversyl. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Perindopril is an angiotensin converting enzyme inhibitor, or ACE inhibitor. It's hydrolyzed by hepatic esterase to yield a prodrug known as perindoprilat. Perindoprilat works by decreasing the activity of ACE, which results in decreased plasma angiotensin II. A reduction of angiotensin II results in decreased vasoconstriction as well as aldosterone secretion. In terms of indications for use, Perindopril is indicated to be used in the treatment of hypertension or high blood pressure, and it can also be used prophylactically, that is, preventatively, in patients who are at risk of experiencing a cardiovascular event. Now, before somebody was to use Perindopril, there are a couple contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used with aliskiren in diabetic patients. Perindopril can also not be used by patients who have hereditary or idiopathic angioedema. Finally, for contraindications, Perindopril cannot be used by patients who have a hypersensitivity to Perindopril or to any other component of the product. Now, in terms of precautions, angioedema of the face, lips, glottis, tongue, larynx, or extremities has been reported with the use of this medication. If angioedema of the tongue, glottis, or larynx was to occur, the medication should be stopped at the first signs and symptoms of this. It should be noted that intestinal angioedema may also occur with the use of Perindopril. Symptomatic hypotension or low blood pressure may occur with the use of this medication. Patients would be at an increased risk of experiencing this if they are also experiencing volume or salt depletion. This may happen with prolonged diuretic therapy, also in patients who are receiving renal dialysis. We want to try to avoid using this medication with aliskiren in patients who have renal impairment, so a glomerular filtration rate less than 60 milliliters per minute. We also want to avoid using this medication with other medications that are inhibitors of the renin-angiotensin system. Hyperkalemia or high potassium may happen with this medication. Patients would be at an increased risk of experiencing this if they were using potassium supplements, if they had renal disease, if they had diabetes, or if they were using potassium-sparing diuretics. A granulocytosis and bone marrow depression may occur with the use of Perindopril, and there would be an increased risk in these patients if they had renal impairment. Hepatic impairment would increase the bioavailability of perindoprilat that we discussed in the mechanism of action. Excessive hypotension may result in a cardiovascular event in patients who have cardiovascular disease. Use of Perindopril is not recommended in patients who have severe renal dysfunction, so a creatinine clearance less than 30 milliliters per minute, and dose adjustments should be made in patients who have mild to moderate renal impairment. It's important to inform female patients that this medication should be stopped once pregnancy is detected. And finally, dosing adjustments may have to be made in elderly patients as well. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Perindopril or Coversyl, they can expect to receive their dose orally. When treating hypertension, initially a dose of 4 milligrams once daily would be used. The dose can be increased to 4 or 8 milligrams a day, given once or twice daily. The maximum dose for hypertension would be 16 milligrams daily. In the treatment of heart failure, 2 milligrams would be given initially, and the maximum dose would be 8 or 16 milligrams daily. For patients who are using this medication prophylactically or preventatively to prevent themselves from having a cardiovascular accident or event, they would use 4 milligrams once daily for about 2 weeks and then increase the dose to 8 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Perindopril, so I'll go over some of those here now. I mentioned hyperkalemia or high potassium. About 6% of patients may experience a backache. Dizziness may happen in about 8% of patients, and some patients may experience a headache. Up to 12% of patients may experience a cough while using Perindopril. Now, some more serious side effects would be orthostatic hypotension or a sudden drop in blood pressure when going from a seated to a standing position, intestinal angioedema, pancreatitis, a granulocytosis or bone marrow depression, liver failure, acute renal failure, or finally angioedema. That's all we're going to talk about today with Perindopril or Coversyl. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.